just going to go ahead and get started. Good evening, everyone. My name is Dr. Paula Coates, and I'm currently serving as the Health and Human Services Facet Chair of the James River Valley chapter of the Links Incorporated here in Richmond, Virginia. I'd like to thank each of you for joining us virtually this evening in honor of National Donor Sunday. The Links Incorporated's Linkages to Life signature program was created years ago with the goal of visiting houses of worship during the National Donor Sabbath weekend in order to educate and inspire individuals about the importance of organ and tissue donation. On this last day of National Donor Sabbath weekend, we have gathered to have a conversation about the gift of life, organ and tissue donation, especially within the African American community. We'd like to thank our esteemed guest speakers who have joined us this evening. At this time, I have the honor of introducing to some and presenting to others the president of the James River Valley chapter of the Links Incorporated, Ms. Rita Henderson, who will give our official welcome. President Henderson.
Well, thank you, Dr. Coates, and happy Veterans Day to all of the men and women, active and retired, who are joining us. Thank you for your service. And on behalf of the members of the James River Valley chapter of the Links Incorporated, and we are 50 strong and celebrating a 40-year anniversary. So on behalf of our 50 members and our chapter organizer, Dr. Lily Bennett, I would like to welcome each one of you, our family, our friends, and colleagues, and if they're members of other chapters, I'd like to welcome you to this virtual platform for what promises to be an informative and much-needed conversation about the importance of organ and tissue donation, especially within the African American community. Now, nationally, the Links Incorporated, with more than 17,000 members throughout the United States of America, the Commonwealth of the Bahamas, and the United Kingdom, London specific, our members focus on 5 programmatic areas. They are services to youth, the arts, national trends and services, international trends and services, and health and human services. So this evening's conversation is hosted by our chapter's health facet, and we thank our facet members for organizing such a necessary conversation, one that we don't often focus on, but is very much needed. So I thank the program chair, Jennifer Royal, who is joining us this evening, and Dr. Coates, who is the chair of Health and Human Services, and the co-chair, Mrs. Josepha Wall, along with committee members, Dr. Audra Jones, Dr. Joyce Campbell, Dr. Vicki Solomon, Dr. Ruth Latham, Ms. Jennifer Royal, who again is the program chair, Ms. Natasha Royal, and Ms. Jennifer Hubbard Davis, who is this evening's moderator and also a nurse practitioner. I thank those members for all of their dedicated efforts to make this conversation possible. In addition, I thank in advance Mrs. Kelly Poindexter, our Zoom czar, who also wears another hat within the organization. She's the national chair of the Signature STEM program for our organization. And I'd like to thank Ms. Adrienne Whitaker, our social and marketing media czar, for all of their contributions bringing forth this evening's conversation. So join me in thanking and recognizing our presenters who are experts in their fields this evening. Latrice Price, Kevin Corcoran, Beverly Bliss, and Bernadette J. Our moderator will share more information about the presenters. Lastly, I thank each one of you for virtually joining us on this beautiful fall evening here in Virginia. You could have elected to be anywhere else virtually or in person, and you accepted our invitation to join our conversation. So we appreciate and it is something, and if something piques your interest or you find something that you want to learn more about, we hope that you will do so. So we recognize it's Sunday and it's football night in America, and so we won't hold you long. Again, happy Veterans Day, happy Thanksgiving and season's greetings. So sit back, relax, and let the conversation begin. I now turn the virtual platform back over to Dr. Coates. Thank you.
Thank you, President Rita Henderson. So our moderator for this evening is Jennifer Hubbard Davis. As stated before, she is a nurse practitioner and active member on the James River Valley Chapter's Health and Human Services Facet Committee. I want to personally thank her for all of her efforts in inviting tonight's speakers. Jennifer, the floor is yours.
Thank you to our chapter president, Rita, and our Human Health Services Facet Chair, Dr. Coates. Good evening to our guests and welcome to our speakers. For questions, please enter the chat. Please enter the questions in the chat addressing speakers to whom you would like to receive your answer from. All questions will be answered at the end of the talk. With absolute great pleasure, I'm honored to introduce our speakers to you this evening. We have 4 experts on organ, eye, and tissue donation. How fitting for the National Donor Sunday. Without further ado, I would like to provide some background on our astute speakers who will speak in the respective order. Our first speaker is Latrice Price. She is a senior community outreach specialist at Infinite Legacy, where she engages the community in discussion about the importance of organ, eye, and tissue donation. Latrice has been with Infinite Legacy for over 25 years, serving on local and national committees and boards of trustees. She has served as a chair on numerous donation-related committees. Latrice loves helping others and is currently a volunteer at Jubilee Arts. Jubilee is a community program providing art classes to our residents of Sandstown, Winchester, Upton, and surrounding neighborhoods in Baltimore City. Next is Kevin Corcoran. Oh, my goodness. Yes, I'm sorry, I had just that clicked on. Okay. I'm sorry. Please give me just 1 second here. I had it up and now I have to find it again. There it is. I am sorry about that. Kevin Corcoran is the president and chief executive officer of the Eye Bank Association of America. Since joining EBAA in 2011, he has initiated a new strategic planning process, an outreach program to foster more member collaboration and engagement, and a new, more assertive legislative advocacy campaign. He also guided the association through reorganization of its governance structure. He has expanded the scope of the association's operations and service areas and initiated EBAA's Diversity, Equity, and Inclusion program. Kevin has over 30 years of nonprofit management experience. Before joining EBAA, Kevin was the CEO of the National Association of Health Underwriters and the American Chiropractic Association. The American Society Association executives granted him the Certified Association Executive designation. He is the vice chair of AMHIC, a self-governing insurance company for nonprofit organizations, and served on the board of directors for Donate Life America. He also served a 6-year term on the board of ASAE Business Services Incorporated and is a frequent lecturer on the association management of topics for ASAE and other organizations. Kevin is a graduate of Georgetown University and recently retired from the role of chief referee for his kids' summer swim team. Up next is Beverly Bliss. She's a dedicated professional who is currently actively contribute to the donation community for over 30 decades, demonstrating her commitment to this noble cause for over 20 years in the leadership roles. Beverly commenced her illustrious career with the American Red Cross, where she spent 25 years honing her experience in the field of tissue banking. While she initially ventured into the sciences of regenerative medicine, her true calling emerged as she became devoted to facilitating families and realizing their aspiration to offer the gift of donation. She achieved this by championing excellence in tissue recovery practices. In 2018, Beverly took on the role of Vice President of Accreditation and Standards at the American Association of Tissue Bank. Following a successful 12-year stint as the leader of RTI Donor Services, she's currently the AATB's Chief Technical Officer. Throughout her 3-decade journey, Beverly has diligently performed a wide range of tissue banking functions, including recovery, authorization, processing, and implementing lean processes to improve strategies. She has also garnered valuable experience as a quality systems auditing, having served as the state of Florida Sterling's examiner. Beverly's unwavering focus lies in nurturing the next generation of tissue bankers through mentorship and fostering collaboration. Simultaneously, she works tireless to instill a quality practice culture among all tissue bankers. Her passion and commitment have significantly impacted the donation community, and her extensive experience continues to drive excellence in the field. Our last speaker is Ms. Bernadette J. She is a seasoned communication professional with over a decade of experience in the nonprofit sector. Leveraging her background as a former broadcast journalist, she excels in building authentic relationships that foster understanding and awareness in the healthcare field. Bernadette has dedicated her career to serving the life-saving missions of organizations like the American Red Cross and United Network for Organ Sharing, where she has played a pivotal role in encouraging undeserved communities to donate life-saving blood and advocating for the transplant community. Currently, as the Ambassador Community Affairs Liaison at the United Network for Organ Sharing, Bernadette has spearheaded the successful management of the organization's community volunteer program, significantly increasing awareness and education. Her commitment to this body of work is underscored by her bachelor's degree in communication studies from the University of North Carolina, Wilmington. Bernadette is deeply passionate about mobilizing volunteers and engaging diverse communities in meaningful conversations about organ donation and transplant. Beyond her professional life, she enjoys staying active through exercise and gardening. As you can see, we have some well-qualified subject experts. So let's get started. Ms. Price, please begin your presentation.
Give me just one moment to pull up her presentation.
I'm sorry, I was talking and I was on mute. I was giving my thank yous to Jennifer for the great introduction, and thank you to the James River Valley Links chapter for having me here tonight. It's an honor to be with you ladies tonight. You can go to the next slide. So who is Infinite Legacy? So Infinite Legacy is the organ procurement organization that covers Maryland, DC, and Northern Virginia. Within our service area, we cover close to 10 million people, 68 hospitals, and 8 transplant centers are located in that area. Next slide. Our mission at Infinite Legacy is to help save lives through organ and tissue donation, and also honor the legacies of our donor families, as well as support the 103,000 people that are on the waiting list for life-saving organ transplant. Here in our service area, there are over 4,200 people that are waiting for organ transplant. Every 9 minutes, another patient is added to the waiting list, while every day 17 to 20 people die waiting for a life-saving organ transplant. Next slide. You can go to the next slide. So what organs can be transplanted? You can click through a couple. So we have the heart. Oh. So we have the heart, the lungs, the kidneys, the liver, the pancreas, and the intestines. So a lung can be either double lung transplant or it can be split, and then 2 people can receive the gift of life from that. As well as the liver is the one organ, the largest organ inside of our body that the one organ that regenerates itself. So a partial part of the liver can be given to one person, and another part can be given to another person. It will regenerate itself. The next slide. The next slide. Okay. What are the 2 different types of pathways for donation? Next slide. So there's living donation, which if someone was interested in becoming a living donor for someone, they would go to one of their local transplant centers. So the kidneys and partial liver can be given, and a partial lung can be given as a living donation. And this process is done entirely, as I mentioned, through the transplant center and not by the organ procurement organization. So Infinite Legacy is the organ procurement organization. So we do not handle the process of living donation. So if someone wanted to do that for their loved one, they would just reach out to the transplant center that their loved one is connected to get listed to be a living donor for their loved one. Next slide. So donation after brain death. Brain death is the irreversible loss of a brain function after a person has suffered traumatic brain injury. So you see here that there's a picture of a functioning brain, and then there's a picture of a deceased brain. A brain dead person. So this is the donation process that Infinite Legacy handles. Next slide. And there's also cardiac donation after cardiac death. Cardiac death is the time in which our heart stopped beating, and then only 5% of donors fall in that category. Often they're only able to donate their liver, their kidneys, and then some tissues can be donated. So this is when the heart stops beating. So say for instance, someone had a heart attack at home. They were through CPR, they were brought back and they're in the hospital, but they're not brain dead. They're on the machine, and the machine is keeping them viable. And so if they're taken off the machine, there's a certain time frame in which they die. Most hospitals have various policies, and most hospitals go with 2 hours. If they die within that 2-hour time frame, then they can be taken to the OR and then recover the organs mentioned, mostly the kidneys and the liver. And then of course, anyone, whether you are in cardiac death or a brain death donor, you can become a tissue donor. Next slide. So tissue donation. Next slide. So these are tissues that can be donated. Cornea, and so I won't get into that because I know Kevin will probably talk a little bit about that. But if a person isn't going to be donating their heart for transplantation, then heart valves can be recovered for someone who may need heart valves. Tendons, veins. Often we know people who have bypass surgeries, and if they can't use their own vein, then they would use vein from a donor. Skin, the biggest use for skin is for burn patients, but skin can also be used as a temporary dressing to help someone who may be diabetic with a diabetic wound. It helps the healing of that process. And then of course there's bone. Bone can be used in multiple different ways. And one of the things bones can be used for is they can grind it up into a putty for dental work as well. Next slide. So other life-saving donation opportunities. So here in our part of Maryland that we cover, just recently, it's been a year now, when someone goes to the MBA, it used to be, I want to be a donor for donation. Now they have the option of saying, I want to be an organ donor for research, education, therapy as well. And education, the education part of that is I want to donate my organs or my tissues so that it can help others in their journey, as well as research. The education part of that could be, for instance, training of the dogs for looking for bodies when there's a traumatic, like say earthquake or something similar to that. That's how they train the dogs to look for to see if there's life in during tragic times. Next slide. So myths as they pertain to organ donation, you can go to the next slide. So this is the biggest myth that we hear. If I have the heart on my driver's license, the hospital staff is not going to save my life. So we spend a lot of time in the community talking about the process of donation, how it's the role of the hospital to do everything they possibly can to save your life. And it's not until all measures to save your life are exhausted that they end up calling the organ procurement organization, in this case it'd be Infinite Legacy, and have us see if you are suitable for donation, because of course not everybody can give that gift of life to help save someone else. But this is the biggest myth that people believe in our community. So next is the religion, like, oh, my religion says I can't become an organ donor, or it's against my religion to become an organ donor. So it's important to know that all major religions do support organ donation in some form. It's just that there are a couple of religions that have some strict guidelines and timeframes in which the body needs to be buried. And so if we don't look like we can respect that religion by honoring the donation process, then we will pass on that donation process. But it is still considered an act of giving for all major religions. Rich and famous people move to the top of the list when they're in need of a transplant. So we explain to people that when someone is listed, they're listed at the transplant center, right? And so we at Infinite Legacy, when we are putting in information to match that donor to the person that's waiting, we don't know that that person has $1 million. So we don't know any information about that person except their medical information, what's needed to match that that organ that they're in need of waiting for. You are most likely to become a donor than you're in need of a transplant. So my department, one day we were reading something and we saw a statistic in the UK. And so we had our data team work on it for us. And it came up for the state of Maryland that you're 12 times as likely will be in need of an organ transplant before you ever become a donor. Next slide. So these are some of the groups that we're connected with that are part of Infinite Legacy. Because we cover all of Maryland. There's Donate Life Maryland. People can register to become an organ donor at Donate Life Maryland. There is DC, Donate Life DC registry. And then of course there is the Donate Life Virginia registry. Next slide. I think this might be my last slide. Before we I end, I think I got a few minutes. I didn't get the warning, but in my haste of just making sure I did a short presentation, I left off two very important things. One person like myself can save up to 8 lives and 9 if they split the liver. And then for tissue donation, one person like myself can save up to 75 lives with all the tissues that can be used to help enhance someone else's life. So questions will be at the end, and I'll be here. And thank you all for your time.
Thank you. Mr. Corcoran, could you please give us some insight about eye donation?
Absolutely, my pleasure. Thank you for inviting me to be here today. I really appreciate the opportunity to address you today. And I am not seeing my slides up. So, and maybe I just need, all right, well, I'll go through. So anyway, my name is Kevin Corcoran. I'm the president and CEO of the Eye Bank Association of America. If we could go to the next slide, please. And like I said, I can't see slides, so I assume this one says about EBAA, 82 member eye banks. So we have 82 eye banks, 66 in the United States. Every eligible eye bank in the country is a member of the association. And we have 16 international eye banks in Canada and then around the rest of the world. And there are organizations like EBAA across the world, in Europe, in Australia, in India, in Asia, in Central and South America. in the Middle East. There is not a lot of structure in Africa, and there was a global alliance of eye bank associations, which are all of the multinational organizations are working to bring eye banking best practices across the world, particularly to developing countries like Southeast Asia, India, and into Africa as well. Last year, our members provided nearly 72,000 corneas for transplant. There are no waiting lists, there are no delays. We're very fortunate in that regard. There's no other country in the world that has a surplus that we're actually able to send over 22,000 corneas outside the United States. Everybody else, really, they're either self-sufficient or most of the world has shortages. It is estimated that there are 70 people in need of corneas for every one that we're able to provide outside the United States. And we recovered these corneas from over 61,000 donors of ocular tissue. We are unique in that because the eye doesn't have a blood supply, it gets its oxygen just by diffusion with the air. Anybody can be a donor to anybody else. We don't have to check blood types. We don't have to check really any issues. We do check for their medical history to make sure that they're medically suited for transplant. But otherwise, anybody can be a donor to anybody. Our timelines are a little bit looser than on the organ side. We have up to 24 hours after the donor has died to recover their tissue, their corneal tissue, and we can keep the cells of the cornea alive for 14 days from death to transplant. So we have more time than the organ donation world, but not as much time as the folks on the tissue side, and Beverly will probably talk about that. Next slide, please. So this just gives you an idea of what kind of impact eye banking and cornea transplantation have. Since 1961, we've provided over 2.3 million transplants, corneas for transplant. So every 11 minutes, someone in the United States is getting a cornea transplant and having their sight restored. We conducted an economic study a couple of years ago to identify what the economic impact is. And we found that the transplants we provide every year have a net lifetime benefit over $6 billion just in the United States alone, to give you an idea of how the impact of eye banking and cornea transplantation works out. Next slide, please. One of the things that we hear from so many cornea recipients is that we've given them their lives back. This is transformative. They were blind and now they can see. Something when I was interviewing for this job, I told my board, the search committee, that one of the things that excited me about this is biblical stuff that we get to do. Making blind people see is just amazing impact. And just one example is Cameron Whittle. We featured Cameron during Eye Donation Month a few years ago. Excuse me. Sorry. Cameron lost his vision when he was 12 to keratoconus, which is a progressive thinning of the cornea. Because it's got a genetic basis, it is more prominent or more prevalent in Black communities than other communities. He got a cornea transplant when he was 13. And when we worked with him for Eye Donation Month in 2018, he was 18 years old, was in the Philadelphia area. When we saw him, he was just graduating from high school. He attended Goldie Beacom College, which is in Wilmington, Delaware. He graduated in 4 years and is now working as a photographer. This is a young man who 10 years before was blind, and now he's using his vision to move his career forward. It's amazing. He's a wonderful young man. We actually will be featuring some blog posts from him during Eye Donation Month this year. Next slide, please. When we look at one of the things I want to talk about, because I think Ms. Price did a great job talking about kind of the donation process, and we follow the same way. But I want to talk about donation within the Black community. And Donate Life America, which is the umbrella group for all organ, eye, and tissue donation, conducted a study to look at the attitudes within minority and underrepresented communities towards transplant. And these are not my original slides, so I apologize for the circles, but they emphasize exactly what I want to emphasize, which is when you look at the reasons why people in the Black community want to donate, and this is the one slide that has Black, Hispanic, and Asian all kind of lumped together. After that, everything is Black. I pulled out just the data for the Black community. They want to donate for the same reason everybody else does. They want to do something altruistic. They want to help people. They realize it's the right thing to do. They realize they don't won't need their organs after they've died. And so they reflect, just the attitudes of folks, across the country as far as why they might want to donate. But when we talked to them about what their attitudes towards donation were, for everybody that was surveyed, whether they were registered as donors or not, 54% were in favor of it, 35% were undecided, and only 9% were opposed. Then we looked at the folks who haven't registered to be donors yet. And what we found, next slide, please, is that while there are a lot fewer people who are in favor, it drops from 54% to 42%, the number of people who are opposed is almost exactly the same. Simply what happened was there are a lot more people that are undecided, hadn't made up their mind, and so they had not yet gone forward to decide to become, to register as donors. So that's very interesting in that because they're not opposed, these are still people who could be moved towards registering for donation. And while on the cornea side, like I said, I mean, anybody can be a donor to anybody else, so there aren't the same racial disparities in the availability of corneas that we see in organs, but it's still important to raise this issue because whether you're registering to be a cornea donor or an organ donor, once you're registered, you're a donor for all three of those types of tissues. So next slide, please. We looked at what the barriers to donation were, and there were a lot of them, and you can see them listed here. But if we go to the next slide, you'll notice something, which is that so many of the barriers to donation come down to the question of a mistrust of the system, which, given the disparities in healthcare for Black and other underrepresented communities, and individuals, that's not a surprise at all. And so that's an area where hopefully more outreach, more education, more access to information will help move people from being undecided to deciding that yes, they would like to be donors. So we looked at what groups are influential for becoming donor, for basically trusted resources that would make someone make the jump from being undecided to being a donor. So if we can go to the next slide, please, you'll see that there are a lot of folks, medical directors, folks from donation organizations like those of us on the call today, nurses, family, friends. But I do want to, on the next slide, please point out that one of the most influential groups are people from the advancement of my ethnicity. So exactly the members of the Links Incorporated. And because so many of your members are also doctors and nurses and lawyers and teachers and other people who are trusted within the community, the people on this call and the people within your organization are exactly the sorts of people that could be bringing more people who are currently undecided or even opposed to donation into becoming donors. So I would encourage you to, as you come out of this call, take this information, share it with people within your community, and let them know that some of the myths that were addressed before are just myths, and they're not true reasons for not being donors, because it can make such an impact on the lives of the people around you. Next slide, please. One of the things that EBAA does in order to drive donor registration is we host iDonation Month, which happens to be in November. And we have numerous resources on our website at idonationmonth.org that are available to everybody. They're publicly available. So I would encourage you, if you're interested in encouraging folks to be donors, there's a lot of information on that website that you can draw upon yourselves and to help convince folks, or at least to educate folks a little bit better on the opportunities to be donors and to help transform the lives of people in your community and across the world. So thank you very much for the opportunity. I look forward to answering your questions in a little bit. Thanks.
Thank you. Ms. Bliss, so glad to have you on board. Please share your information about tissue donation.
Thank you so much, Jennifer. I appreciate it. I just have to tell you, thank you. It's such an honor to join such an incredible group of strong women leaders who are inspiring a community to do so many incredible and powerful things. So thank you very much for allowing us to have this opportunity to talk. So Jennifer, are you going to put the presentation up on the screen?
Yes, Kelly will help with that.
Oh, okay. Zoom has not been our best friend tonight, has it? Well, I just want to, I'll just kind of start talking. So a lot of things that Kevin said and were said before, they're true about tissue. Tissue does have some real differences, and I do want to speak to those because I think those differences actually lead to a lot of concern and misinformation that is prevalent in the communities that we attempt to educate about the benefits of tissue donation. And so I will speak to that. So if you just want to go to that next slide, thank you so much. And just oops, if you want to put me, there you go. Just a little bit about us, in case you haven't heard of us, the American Association of Tissue Banks. We were founded actually in 1976 by a group of doctors, physicians from the Navy Tissue Bank. And they actually have been providing tissue transplants to military personnel and their families, mostly inspired by the events of World War II, in which there were some extraordinary musculoskeletal injuries and burns that required repair using what we refer to as allograft tissue. We really believe in using the body to heal the body. AATB itself, we are a nonprofit scientific educational organization. We're actually the only standard setting body in the United States today, and we are considered by many of the regulatory agencies, the FDA, CMS, as being the resource for understanding how to promote donation, but also how to protect the safety and efficacy of tissue transplantation. One fact that we do know, we may not have within our community of accredited tissue banks all of the tissue banks in the United States, but we do know that the overwhelming majority of tissue that is transplanted in the United States today is coming from these AATB accredited tissue banks. Next slide, please. This is just a quick little snapshot. I just wanted to, in case you didn't know us, I just wanted to give you a snapshot of who we are as an organization. Looks like a lot of folks, but just to give you some context, we serve over 7,000 members and over 124 institutional members that have hundreds of members within each of those institutions. So it takes a lot of us to make sure that we're doing all the things necessary to ensure a safe supply of tissue out there and that education to the communities is done effectively. Next slide, please. We all have bosses. These are our bosses. They're the AATB Board of Governors. They are folks that represent tissue establishments throughout the United States. They volunteer their time and their energy to make sure that they provide us with good information to help us balance all the things that we do on behalf of the membership. Next one, please. So tissue donation, the awareness and education for tissue, in general, it's the same for organs, but it actually is. It has a lot of key differences, and I do want to talk a bit about those because those are important to talk about. One of the things that is challenging for the tissue banking community, which doesn't include the iBanking community, so Kevin, not leaving you off, but we are highly regulated by the FDA, which can present a lot of challenges to us in terms of how we are able to offer donation services to families, how we're able to recover that tissue, and then ultimately how we're able to prepare and provide back for transplant that tissue into our communities. And that is very different. The organ donation community doesn't have quite that same structure, but we've all learned to live within it. But it does present a challenge for our particular community. And then, of course, there's our professional education versus our community education. For us, professional education is going to be in our healthcare facilities, talking to the doctors, the nurses, the healthcare providers, the people who are used to administering health services and working with families, particularly under extraordinarily difficult times when someone they love has passed away. And then there's community education, where we're trying to create this dialogue, this rhetoric, this conversation about the positive aspects of enrolling in a donation program, because you will benefit so many people after you have passed away. Or even if you want the opportunity to be a living donor, we're going to provide an education as well. Next slide, please. We actually, I'm going to take a little bit of a different run here. I'll talk a little bit more about tissue donation in a minute, but I just want to talk about the DE&I program that AATB has put in place. So we really did, we've talked about this for a while, but we wanted to put some more formality around that. And we did know that we needed to find a way to build a community of people who understood DE&I, understood what did that really mean, how did that translate into the tissue banking community, and then also making sure that they understand that there are 3 different parts to that process, and you can't just lean into one part of it. You have to lean into all 3 of that. So we actually were committed to building this DE&I community that was resourced by not only people from our community out there, but also reaching into other communities to get their information, get resources, and then connecting people into those other communities so that we all together could learn how to be good educators, good stewards of the gift for everyone, and not just look at this as not being necessary, but look at it as being necessary. Next slide, please. So we went ahead and we formed our official DE&I committee in 2022. Our committee has our AATB leaders. It has our members who are all from diverse communities. We really think it's important to make sure that we're including folks community of racial diversity, cultural diversity, and also lifestyle diversity. And as an indicator of our commitment to it, our president and CEO is a standing member of the DE&I committee, along with myself and other board members from our board of governors. And we will continue to provide resources to this committee to make sure that they are well supported as the years go by, and we continue to build the sophistication of this program. Next slide, please. I feel like I'm going a lot about DE&I, and I hope that's not a bad thing here. So our DE&I commitment actually expressed itself most clearly in our 2022 AATB annual meeting. We actually had a dedicated DE&I education track, and we had standing room only in many of those sessions. And even one of our plenary sessions was focused on a DE&I speaker who talked very comprehensively about DE&I within, racially diverse communities. And I can tell you we had an incredible amount of positive feedback from that. We also have put together a list of definitions to make sure that we're educating about DE&I, and we're finding that people really didn't know the terms. And I think it's really important that people know what these terms are and why these terms exist, and what then they should do to respond to these things happening within their own communities. We're going to continue to bring these resources to our website. We're going to make sure that we talk about it as often as we can, not only in a conversational way, but in a very formal, send reports to our board, our membership. And then this year at our 2023 annual meeting, we had even more expanded DEI track and even more people in those sessions. And that really tells us everyone just wants to know. They want to know more. They want to say, how do we be part of this work and make sure we're doing the right thing. Next slide. So we're going to keep doing this. I already kind of talked about it. Let's go ahead and go forward from this slide. All these folks are representing people that we have supported either by taking them into an event where they could talk about their experience as a tissue recipient. There are folks here who have received tissue transplant. There's one gentleman here in the purple. He not only was a tissue recipient, but he lost his wife as a result of the fire that necessitated his skin transplant. But just to kind of wrap it up, I just want to talk about, tissue donation is a very extreme process in terms of how it looks for other types of donation. And when we are talking to folks in the African American community, we're talking about doing something to the body of their loved one that might seem extreme, and it might seem alarming, and it might confront the issues of how will funeral service look for them, how will open casket look for them. And I think the education into the communities are so important in terms of explaining why tissue donation has to be done the way it has to be done, but why is it so important? And it's important because you have people who can't go on with their lives because they might have a cancerous tumor in their leg that unless they get a bone transplant, they're going to have an amputation. There, you see Mary Lewis in the corner there. She's a breast cancer survivor. She relied on allograft tissue to help with reconstruction after her breast cancer surgery. The gentleman in purple, he had dermal grafts. The list goes on and on. The young lady over there, she had to have a tendon ligament repair in order for her to continue to have an active life. And you can see how young she was at the time, and her whole life would have been framed if she would not have been able to receive that gift. So the gift of donation is really important, no matter what community you're talking about. And I think our next speaker will talk a lot about myths, but one thing that I will emphasize is tissue donation has it has no barrier in terms of race or ethnicity, cultural belief, religious belief. It is something that anybody can do, that it doesn't need to be matched. There aren't any special recipients. Anyone can receive a tissue transplant if that's needed under medical direction. And also open casket funerals, or whatever you want your funeral service can be, will be possible following tissue donation. And that is where I'm going to then pass this along to our next speaker, who will take us into a more comprehensive discussion about, I believe, myths and the other things that we might want to know about. So appreciate your time. I hope I've answered your questions, but if not, please drop a question in the chat. Happy to answer that for you. Thank you so much. And sorry if I went over.
Thank you. Thank you, Ms. Bliss. But last but not least, Ms. J, please provide some information on myths as it relates to organ and tissue donation. We are so excited for this segment because this segment will clear a lot of myths and give you some information about organ donation. Thank you.
Thank you, Jennifer, and good evening, everyone. I extend my very sincere thanks to the Links James River chapter for inviting me as we recognize the Donor Sabbath. Again, my name is Bernadette J. I'm the Community Affairs and Ambassador Liaison for the nonprofit organization United Network for Organ Sharing. As we're talking about donation and transplantation tonight, several of my friends, my loved ones, have been impacted by organ failure. It's not something that everybody is always comfortable talking about. But even last August, I lost my grandmother. She had end-stage kidney disease. A few weeks ago, my neighbor right next door shared with me that they were experiencing kidney failure. So the need for awareness and registered organ donors is so important. So I strongly encourage you all to have a conversation with your loved ones about your decision to be an organ donor so they are aware of your wishes. Really quickly, I want to share more about UNOS, United Network for Organ Sharing, just a really high-level overview. We are located in downtown Richmond, right off of 4th Street. I invite you to visit us. We are home to the National Donor Memorial. As I mentioned, we are a nonprofit. We manage the contract of the Organ Procurement and Transplantation Network, also known as the OPTN. This is a unique kind of public-private partnership that links all professionals in the U.S. Donation and transplantation system, and it's a relationship that continues to evolve as we prioritize the needs of patients. Again, I'm going to focus this evening. I'd like to share some myths and facts about organ donation and transplantation. Okay, so the very first one here, if emergency room doctors know I am a donor, they won't try to save my life. And as Latrice mentioned earlier, if you're in the hospital, the priority is to get you well, is to save your life. The doctors who work to save your life are not the same doctors or staff involved with organ donation. So it is only after every attempt has been made to save your life that donation will be discussed with your family. And again, those conversations, these type of discussions are so necessary. So please be sure to let your family know of your decision to be an organ donor or tissue donor. When you're waiting for a transplant, your financial or celebrity status is as important as your medical status. And Latrice also touched on this just a little bit. The organ allocation and distribution system is blind to wealth or social status. The length of time it takes to receive a transplant is influenced by a variety of factors, including where are you, your severity of illness, the physical characteristics, blood type, weight, your genetic typing and size. A grown man cannot receive an infant's heart, right? It's the length of time that you're on the waiting list. Factors such as ethnicity, gender, age, income, or celebrity status is never considered when determining who receives an organ. Another myth, they might take my organs before I'm really dead. So organ donation is only accepted following the declaration of death by a doctor not involved in the transplantation. In order to donate organs, a patient must be declared dead using specific medical criteria. And I can't remember which speaker, but we saw that brain scan imagery there. But basically it's using specific medical criteria a physician can confirm brain death. And I don't want to go too deep into it, but you have to pass away in a way that your organs are viable, that they can be procured, and that they can be life-saving to a patient who's on the receiving end. Another myth, it is in my will that I want to be a donor, so I don't need to tell my family and friends about my wishes. I don't really want to talk about death with them. Again, I encourage you, have a discussion with your family so they are aware of your wishes. And you should electronically register, as an organ donor. We talked a little bit tonight about, registering with the DMV. You can also go online at registerme.org. You can sign up as an organ donor on our website, unos.org, the DMV, Donate Life America. But be sure that your family knows about your wishes, that you're having those discussions, and ask your family what their wishes are as well. Another kind of myth, if I agree to donate my organs, my family will be charged for the cost. Please know there is no cost to the donor's family or the estate for organ and tissue donation. Funeral costs remain the family's responsibility. Another myth, my religion prohibits organ donation. You should know all kind of major organized religions approve of organ, eye, and tissue donation and consider it an act of charity. Another myth, I'm too old and sick to be a donor. People of all ages should consider themselves potential donors. Your medical condition at the time of death will certainly determine what organs and tissues can be donated. But with recent medical advances in transplantation, many people than ever before can be donors. Another myth, I have heard about people who steal kidneys and sell them on the black market. Please note it is illegal to buy or sell human organs in the US. In addition, a national governing body reviews every organ donation and transplant. So strict regulations prevent any type of black market existence, in the United States. Again, I challenge each of you to have a discussion with your loved ones about your decision to be an organ donor and ask them about their decision. Have a dialogue. You can even reference some of these myths versus facts. And of course, we could go on and on and on about some of the things that we've heard over the years, some of the conversations I've even had with my loved ones, with my dad, with my mom, and some of my siblings. But anyways, I thank you all so much for your time.
Thank you. That was very insightful and very impactful, and I hope you all enjoyed it. Are there any questions? I do believe we do have one that was in the chat. And the question is for Kevin. What is the process for donating eye tissue?
So the recovery process is after the donor dies. The hospital is required to notify an entity, and it's usually the organ procurement organization because they have the tightest time frame. So they will be notified first, and then the eye bank and a tissue bank will be notified. We go to where the donor is. We do a full inspection of their body to see if there's anything that would be an obvious rule out. It could be indications of illness or disease that would be a concern. It could also be an indication that they are intravenous drug users or have other behaviors that would be of concern. And then we just take out the cornea, which is the clear outside part of your eye, essentially what would be covered by a contact lens. We don't take the whole eye, probably 99% of the time. Sometimes we do. Usually that's for research purposes. So we just cut out the cornea, We have little kind of plastic or rubber caps that go on top of the eye so that, again, you can have an open casket funeral because your eyes are closed. We bring the tissue back to the eye bank. We look at it under a microscope. We also draw blood from the donor, so we send that out for blood work to see if there are any bloodborne diseases, which, like I said, the cornea doesn't have a blood supply, but we're regulated the same way tissue banks are. So we do have to rule out for bloodborne diseases like hepatitis, HIV. Now we rule out for Zika and Ebola as well, and syphilis as well. And then we can, like I said, we can hold the corneas for up to 14 days before we distribute them. So the eye bank will hold it, and then when a surgeon calls and says they are going to perform a transplant, we'll get information from the surgeon of exactly how they need that tissue prepared, and we prepare it so that all they have to do is go in, remove the diseased cornea for the recipient, put in the new cornea, and the transplant goes a lot more smoothly because we're doing the prep work. I hope that answers the question and not how do you go about registering to be a donor, because I'm realizing that could have been the question. And for that, you can do it at DMV. You can also do it at, is it registerme.org? I always get that title wrong. But if you search for register to be an organ donor, you'll get the form. Basically, you just fill out your name, address, and contact information, and you can be registered as a donor.
Another question that we have is, for a person to be a match for an organ, what exactly needs to take place and what tests are done?
Bernadette, do you want to take that one?
Latrice is muted, but I think she seems to be talking.
Okay, I was asking Bernadette if she wanted to take that, being but again, could you repeat it again? I'm sorry. What?
For a person to be a match for an organ, what exactly needs to take place? What tests are done?
Okay, so there are a series of so I heard a nurse one time say that if you're an organ donor, you're going to get the best physical ever in your life because they run various tests on all the individual organs. Blood work has to be drawn. So they're going to work you up as if you are getting, again, the best physical of your life, because they want to make sure that those organs are going to be viable and usable for someone else, that someone is waiting for a transplant. And so that sometimes that process can take about 24 hours because we do try to match every organ before going to the OR. So we Infinite Legacy are working with the UNOS waiting list system and matching each. So we match, looking at the kidney and see who is the match for the kidneys. And they're not just calling one person, they're calling maybe a second person, sometimes a third person, because if something is going on with that first person and they can't receive that transplant, they want to have a backup. So they are calling for each individual organ, multiple people. So that process can take up to 24 hours before they even get all the people that are waiting into play in position to be able to receive those organs.
Okay, that's great. Another thing is there any, I guess there are numerous chronic ailments that could completely disqualify you for organ donation? What would be it besides cancer? Are there any ones that particularly would stand out? And if they had cancer in their bodies, what can they or can they not donate?
So for organ donation, we tell, I think Bernadette mentioned this, like almost every illness can be considered for organ donation, just depends on the manner in which you die. Even in 2013, President Obama passed the HOPE Act, which allows HIV patients to donate to HIV patients as well. So we encourage people, regardless of what your illness is, of course, active cancer at the time of a person's death will you will not be able to be an organ donor. But Kevin mentioned when he spoke about the eyes, and there's no blood flow to the eyes, so potentially that person could help give sight to people to people who are blind. Like I think it's Cameron was his name. So we will encourage people to regardless of what your illness is, to still look at registering yourself to be an organ donor.
What is the normal recovery time for a live donor?
I'm not sure about living donation because that happens at the transplant center. And so I'm not sure like how long it takes, all the tests that the person who's going to be donating has to go through. So I'm not sure how long that whole process takes. I know that a lot of times the person donating gets out of the hospital before the person receiving, just because I had a friend do that donation process, gave a kidney to her mom, and she was ready to go home in a day or two, and her mom was in there actually a couple of days longer.
Okay, and then we have, in addition to your health, how does your age impact organ donor's decision?
So are you saying should someone of a certain age not be considered for donation, or should they remove themselves off?
Exactly. I've had people to say, I think I'm too old to become an organ donor.
Yeah. So we, again, age, like just like medical age, it doesn't factor in. We can have somebody who's 86 years old take better care of themselves than a 35-year-old. So it just depends on, how well that person has taken care of themselves. Okay. So again, if somebody's 100, leave them on there. With the way the medical technology is going these days, you never know. There are things that they can do to organs to preserve those to be used for transplantation to help someone live.
In addition to the transplant, what I heard also was for research. So there could be two different ways.
Yes, absolutely. Yes, they can be used for research and education.
And just to chime in for tissue donation, there really isn't a technical upper age limit for tissue donation, but there are evaluations that are made depending on the type of tissue donation that is going to be done. Obviously, as we age, our bone tissue tends to get less strong, get more porous. So there a lot of doctors will not be overly comfortable with using bone tissue for structural purposes over someone of an advanced age, but there are a lot of other tissues that could be donated regardless of age. And I just wanted to go back to the cancer question just a little bit. As far as cancer for tissue donation, there are a lot of rule outs for cancer for tissue donation. There are a couple of cancer, particularly if they were a skin cancer that had been resolved, like an in situ type of cancer had been resolved. But, in general, because we don't know how cancer is transmitted in a transplantation environment, it's better to be cautious than not. As Kevin was saying, they don't have the corneal tissue, the eye tissue is not draining to the same systems as you see organs are having access to the full adrenal system and as our tissue. So we have to be a lot more cautious about what we're going to accept in terms of cancer. And then, of course, for age, because of structural reasons.
Thank you. Do any of our speakers have anything they would like to add before we close out?
I do. So Kevin, as well as Bernadette, mentioned a couple of times about barriers and decisions. So in 2016, we had pulled some data on the number of designated donors by zip code in Maryland. Found that one particular zip code had a low number of people designated, but then pulled the same data for people on a wait list and found the exact same zip code had the most number of people waiting for a life-saving organ transplant. So we started a grassroots initiative called the Decision Project. So it's interesting, Bernadette kept saying decision, because it is a person's decision. And we don't want their first time hearing about organ donation. It's during that tragic time, when someone like an Infinite Legacy staff person is asking them for their loved one to become an organ or tissue donor. We want them to know about it ahead of time. We want them to have that conversation with their family. This is what I want if something happens to me. What do you want if something happens to you? So we really, really encourage you to have those family conversations about organ donation, and not just organ donation, about end of life decisions in general. Families tell us all the time, if I only knew what they wanted, it would make the decision a lot easier. And so having those conversations makes it a lot easier for your loved one.
Thank you.
I agree, Latrice. And I just shared a link in the chat for registerme.org. Kevin mentioned it. I mentioned it. It is a personal decision. I'm not here to tell you you should be an organ donor. It's a decision that you make personally. And I can tell you, for me, I know my family knows. And when I had the conversation with them, they said, well, why do you want to do that? You know, and of course, there's a lot of things that have happened in the history of organ donation and transplant that has helped to create a lot of myths, a lot of distrust within our community. But it's still important to have the conversation. And so I know, should the time come and I'm on a ventilator and I'm declared brain dead, my family will have no problem being able to share with the transplant coordinator there my decision to be a registered organ donor. But throughout the process of receiving an organ or having a transplant, you're going to have a transplant team working in your favor. So they're going to be the ones to make the decision about whether or not an organ is going to be the best one for you. But there's so many different conversations that we can have, and we really could go on for probably another 3 hours here about some of the myths and some of the things surrounding organ donation and transplant. But I think I speak for all of our speakers when I say I'm just so grateful to be part of this discussion tonight.
This was excellent. This was excellent. I'm going to turn it back to Paula.
Thank you. Thank you, Jennifer. Wow, what can I say? This has been an excellent time this evening. Thank you to our speakers, Latrice Price, Kevin Corcoran, Miss Beverly Bliss, and Bernadette J, for sharing so much valuable information this evening. We all have learned so much. We thank you for taking time out of your busy schedules to join us. To our moderator, Jennifer Hubbard Davis, thank you. You did an amazing job serving as our moderator. The James River Valley Chapter's Health and Human Services Facet members would like to thank our president, Rita Henderson, and our chapter members for your support. Again, kudos goes out to our members, Kelly Poindexter, Josepha Wall, and Adrian Whitaker for helping us on this evening. I personally would like to thank all of the members of the James River Valley Chapter's Health and Human Service Facet Committee for their input and support. Last, but certainly not least, we want to thank each of you, our viewers, for joining us this evening. We hope that something was said tonight that may inspire one person to consider becoming an organ donor, or at least seriously considering it. So enjoy the rest of your evening. Have a great week. And again, happy Veterans Day to all of our veterans, and happy early holiday season. Thank you and good night.
Thank you. Good night.
Thanks so much.
Thank you.
Night. Thank you.